This Let's Talk About Women's Health series has been brought to you by Tallaght University Hospital. These podcasts have been kindly supported by the Healthy Community section of South Dublin County Partnership. You're very welcome to our first episode. I'm Nolene Leddy, the Deputy Communications Manager here at Tallaght University Hospital. And on this podcast, we'll talk about some of the key health checks for women. To discuss, I'm joined by my colleagues, Consultant Gynaecologist Dr. Aoife O'Neill and Sinead Cleary, an Advanced Nurse Practitioner in Women's Health. You're both very welcome. So Aoife, as a consultant and a gynaecologist and a woman, what health checks would you recommend for women?
Thank you very much, Nolene, for the opportunity to talk about this. I think the first thing that I would like to say is that women in Ireland are very good at seeking information, but maybe not talking about their health. And in Ireland, we have a system where the first port of call when people have any concerns about their health is to go to their GP with their concerns. But I don't think we talk a lot about, the areas of concern for women particularly. As a gynaecologist, my area of expertise and specialism is in the area of reproductive organ disorders or diseases. And so very often people come to my clinic when their GP has referred them with a problem. But there are many health checks that we do through the HSE National Screening Programme that are looking at people who are healthy, who are being screened for the presence of an early form of a disease and wouldn't be expecting to have any symptoms from that disease. So they are the health checks that I would like to focus on today and just advise people about how to know about these and where to get information on these health checks. The three main screening health checks that are recommended that women need to know about, and most women would know about the cervical check screening programme, the breast check screening programme, and not to forget that there is a national screening programme also for bowel cancer. We in gynecology know a lot about the cervical check screening programme, which is what we're going to talk a lot about in this podcast.
So tell us, why is it so important to get a cervical screen?
In women, our genital organs are hidden from view, and so the cervix is the neck of your womb. So unlike your hand or your nose, you can't actually see it at all. And what we know about cervical cancer is that it is a very slowly developing process. Mm-hmm. And the cells in the neck of the womb, or the cervix, we can take samples of the cells and look at them under a microscope. And that allows us to see any small changes that might be happening in that area that have the potential to, if they're ignored and weren't looked after properly, they have the potential to turn more serious and potentially in years to come turn into a cancerous growth.
So these are pre-cancers, if you like.
Yes, they have the potential to become cancerous. So that means that they can turn into an abnormal form, these cells. That doesn't mean that all the abnormal cells are pre-cancer. But they can, if they're not followed and not treated properly when they become abnormal and have the potential to turn into a cancer, then you miss that opportunity. The whole idea behind this screening programme is to allow people the opportunity to get a test to identify the problem at a very early stage, which then helps reduce their risk of ever getting a cancer in that area.
And women really should start having these smears in their 20s?
Yes, the National Cervical Screening Programme starts the screening at age 25. And the reason that age was picked on is because we have a lot of evidence in years gone by that changes in the cells that can happen at an earlier age often revert back to normal by themselves. And so a lot of young women were having loads of smear testing that didn't really require any treatment because the changes were going back to normal by themselves. The evidence that was gathered through the years has now pinned down that the ideal time to get screening to reduce your risk of cancer of the cervix is between the ages of 25 and 65 years of age.
And am I right that a smear is the same as a cervical smear?
Correct. We We use the terms interchangeably. A pap smear would have been the old terminology. A smear test refers to a sample taken from the cervix, and a cervical smear is the same thing.
And what would you say to a woman who might be embarrassed about going for a smear? And it is a slightly uncomfortable test.
Yes, I think many women have this fear about going to any doctor, whether it's male or female, about any intimate examination. There's a fear around the fact that it's an embarrassment exposing yourself. And that's a very cultural, deep-seated fear in many Irish women, because we are not like our European counterparts. We're not in the sort of habit of seeing our doctors on a frequent annual basis for a health check like this. But I would say to all women that it is a vitally important part of keeping yourself healthy, because you cannot see this area, you cannot feel it, you can't assess it. So it's quite a different part of your body that you can't get at. If you compare it, for instance, to breast check, where you can access and you can examine and you can know what's normal about your breasts, that isn't the case with your cervix. So that's the reason for recommending it.
And is the hope that you'll save lives by picking up things early? Prevention is better than cure, or early detection leads to better outcomes?
Yes, the evidence is very strong in showing that picking up and being able to treat cancer or a pre-cancer of the cervix prevents that person from developing the cancer. Almost all forms of cancer of the cervix are able to be picked up at an early stage. Not every single cancer of the cervix can, but the cervical screening program is looking for people who have human papillomavirus, or HPV, and many of our listeners might be aware of the HPV vaccination that they can get to help reduce their risk of developing HPV-related abnormal changes.
Sinead, you look after people who've had abnormal cervical smears. What happens when an abnormality is detected?
For women, when they attend for their cervical screen, where HPV is found, that sample is then checked for abnormal cells. In the case where abnormal cells are found, then they're directed to colposcopy, which is the diagnostic test. This is the test that women go for to see, well, are the changes that were suggested by their cervical screen,
Colposcopy refers to your cervix.
Colposcopy is looking at the cervix under magnification with a bright light, and we use dyes and solutions which can show up abnormal cells. Equally, HPV can be present, but no abnormal cells are seen.
Why are you looking for HPV? What damage could it do?
The HPV virus is a very common family of viruses. It's the human papillomavirus, as Aoife says, and 80% of us will come in contact with HPV across our lifetimes, and 20% of us might always have HPV, and that's okay. But what HPV can do is it can cause changes in the cells of the neck of the womb. Now, for most of us, we'll clear the HPV virus within about 18 months to 2 years. If that doesn't happen, or in the course of that 18 months to 2 years, then the HPV can cause changes in the cells of the neck of the womb. And those changes in the cells of the neck of the womb are what can go on to become, in some cases, a cancer of the cervix.
So when a woman comes to you, what has happened? In fact, they have found abnormal cells.
Or they have found that she has HPV for 2 consecutive smears in a row. So there may be no abnormal cells found, but both tests 1 year apart have found the HPV virus. And given that the HPV virus is the risk factor for abnormal cells, although the smear hasn't found any, we have a closer look at the neck of the womb to see, well, are there any changes in the cells of the neck of the womb? And if there are, then do they need treatment, or are they likely to go back to normal by themselves? Because the vast majority of these changes will go back to normal by themselves, particularly low-grade changes, what we call CIN1, which is a very mild change in the cells of the neck of the womb, and indeed CIN2 in young women, particularly in those that are vaccinated, because they're vaccinated against the most high-risk types of HPV, and those are the subtypes or the types of HPV that are found in high-grade lesions, and it's the high-grade lesions that have the genuine borderline risk of developing into a cancer if they're not treated.
And so for some women, sadly, it does turn out to be a cancer. Are there treatment options?
Absolutely, and certainly where these abnormalities are detected through screening, 80% of the cervical cancers that are diagnosed through cervical screening and colposcopy are diagnosed in stage 1, which is entirely treatable and indeed curable.
So it is really important to go get your smear. Please God, it won't be there, but if it is there are treatments available.
Absolutely, and since 2010, we've been vaccinating girls with the HPV vaccine. And since 2019, we've been vaccinating boys and girls. And indeed, it changed. Prior to 2019, we used a quadrivalent vaccine which protected against 4 types of HPV, 2 of them being the subtypes 16 and 18, which are the ones that are found in the squamous cell cancers that can develop at the neck of the womb and the adenocarcinomas that can develop at the neck of the womb, and then also 2 subtypes that can cause genital warts. In 2019, we moved to a nanovalent, so it's covering 7 of the most high-risk types of HPV, as well as the 2 that prevent genital warts. So for our population now that will enter into the screening programme, because they're now turning 25 from when the programme started, because you're vaccinated in first year in school, so around 12 or 13 years of age, that they will be protected against the high-risk types of HPV that cause the high-grade abnormalities.
And Aoife, is that something you'd recommend, that people have the HPV vaccine?
Absolutely. Vaccines save lives, and that is because they are cutting out that big risk factor for making a cancer. And as Sinead mentioned there, it's boys and girls that are offered this vaccine, because HPV virus has shown to be associated with both not just cervical cancers, but also vaginal cancers, cancers of the vulva, which is the external part of your vaginal area. It also is linked with penis cancers and cancers of the anal area. And so it's not just protection against cervical cancer. And as Sinead also mentioned, it also protects against genital warts, which people don't really know much about in terms of the protection it offers in addition.
So Sinead, who are the types of people who might need a little bit more encouragement to come and have their cervical screening done?
There are newcomer populations that we have in Ireland now who are coming from countries that don't have a screening programme, an established call and recall screening programme, as we understand cervical check to be. So they may not be used to having these sort of examinations done, and particularly where English isn't the first language, that sometimes that population have difficulty accessing healthcare and accessing screening. And I know that Cervical Check has done a lot of work in producing videos and information leaflets in different languages, and a lot of advocacy groups offer interpreters to go along with women so that they can understand and consent to the importance of procedures like cervical screening. Also, women with disabilities, perhaps, who are in wheelchairs or have mobility difficulties, that may need extra assistance, even into being able to get into a position to have the screening test done in the first place. And we would get a lot of referrals from GPs saying, this woman is in a wheelchair, or she needs a hoist, or she just has additional requirements, and we can often facilitate them here in TUH because we have additional staff, we've got bigger examination rooms, we have hoists. The other population that can often be underscreened are those that are born with a cervix but don't identify as female or as a woman, but they're born with a cervix. So any person born with a cervix needs a cervical screen done, and we would encourage all people born with a cervix to attend for these screening tests. And sometimes that means maybe ringing up beforehand, because I know here in TUH, when we get a colposcopy referral that would identify a trans man, we would ring and check that we have the correct name that they wish to be identified as, and we will talk to them and say, what language would you prefer that we use, what are your preferred pronouns, and we make it as gender neutral, as understanding as we can for intimate procedures like this.
So finally, Aoife, why are screening programs so important?
They're so important for people to be aware of the availability of screening programs and to answer the invitations, because screening has been studied for many years now, and it has the ability to pick up a particular disease or a condition at a very early stage in its development. And that means then that the treatment for it is much simpler, much more straightforward, and can actually prevent the development of a cancer. And that's the three main screening programs that I like people to take home the message today. Please attend for your cervical check, your breast check, and your bowel check screening when you're invited.
Because it's also looking for red flags or alerts before you ever have symptoms. Mm-hmm. And that's what the screening programme is built on. It's a population-based screening tool looking for a red flag that might suggest that a person might be at higher risk of developing something that could go on to become a cancer. So for cervical check, certainly we do 25 to 65-year-olds. For breast check, we do 50 to 69-year-olds every 2 years, although there was some delay during COVID, which I understand is caught up on. And then bowel screen is every 2 years from 59 to 69, and that's obviously both men and women.
So these are free, and for the good of your health, it's well worth doing it.
Absolutely.
Absolutely. Why wouldn't you? If you can pick up a disease at a very early stage where you don't even know you have it, you haven't even developed symptoms, and the treatment for it is much, much simpler than if you then went on to develop a cancer, because treatment can be more prolonged, and you may need surgeries or things that you wouldn't have needed if the disease had been caught at a much earlier stage.
And I suppose my other take home from this podcast is vaccination. Mm-hmm. Because not only can we treat something, but we can prevent it in the first place. And the WHO goal is 90% would be vaccinated by the age of 15. Ireland stands just below 80%.
This is in terms of the
HPV vaccination programme, absolutely. So when that letter comes home from school in September, October, that parents sign it, and that boys and girls in first year in school can be vaccinated to prevent them ever from developing a cancer, a cervical cancer or an anal cancer, or even a 35% reduction in mouth and throat cancers.
That's it for our first episode of this series. Thanks to our experts, consultant gynaecologist Dr. Aoife O'Neill and Sinead Cleary, an advanced nurse practitioner in women's health. Our next podcast will look at the condition of endometriosis and how it can be treated. This Let's Talk About Women's Health series has been brought to you by Tallaght University Hospital. These podcasts have been kindly supported by the Healthy Community section of South Dublin County Partnership.